Okay, so welcome to our tour of the University of Toledo's medical physics program. We're going to start our tour in the Department of Physics and Astronomy on the main campus. This is where physics PhD students will start their training. This is also where master's degree students come to take a summer lab course. So we're going to take a look inside. Let's go. Okay, so we've come here to the main campus Physics and Astronomy department, and we're going to meet today with Dr. Rick Irving, and he's going to show us around the department and let us know about what kind of facilities we have here. Take it away, Dr. Irving.
All right, Dr. Pearson. So this particular lab we're in right now is both an undergraduate and graduate lab. And in part of the lab, we teach advanced electronics for undergraduates and graduates. And primarily for the medical physics program, we highlight the nuclear physics laboratory. So this section of the room houses the nuclear physics laboratory equipment. And I'm going to look at my notes here just to make sure we get the description straight. So the course description is experiments in nuclear. In this particular lab, we don't do atomic. That's located upstairs. And condensed matter physics such as gamma ray, X-ray spectroscopy, beta and alpha particle spectroscopies. Okay, and so this is a 1 4-hour lab per week, and I believe it's worth 2 credit hours. So so some of the experiments we do are really here to help the medical physics students get used to playing with detectors, talking to detectors, because everything they use at their facility is all wrapped up nice and tidy in a beautiful package. Where here they really get the experience of what's inside the equipment, at least get some idea of what's inside the equipment they utilize over at UTMC. And so the real important things are playing with the electronics and signal processing, and then using that to talk to detectors, various detectors. We utilize PMTs, surface barrier detectors, and several others that they learn how to do, utilize. So here's a couple of experiments. They start off first with the introduction, playing with nimbins, wonderful oscilloscopes. We also have a digital oscilloscopes. Analog scopes are beautiful because they don't have the lag and refresh rates that digital scopes do. But digital scopes are very nice because you can deal with signal processing. So yeah, gamma ray spectroscopy, absorption cross sections, electron positron annihilation for utilizing coincidence techniques. Again, I mentioned surface barrier detective and alpha spectroscopy. Each one of these labs is about 2 weeks long. So again, they deal with detector efficiency measurement and alpha energy spectra, energy loss in air and helium gas. High resolution. So we go from, maybe the cheaper kind of detectors to a high resolution germanium lithium ion detector, and again they get to see, for another $10,000 how the equipment responds very nicely. So, but with the high resolution detectors, they do comparison of spectra taken by the scintillation detectors that they're introduced to first, and then they can see the difference in the quality of the information they can derive from the signals. And then the last part of the lab is they have to design and build a Geiger-Miller detector from scratch. So they always love that one, where they've learned all about the detector. Are you allowed to bring the camera around?
Yeah, sure.
Talk to the hardware or tech modules, and then the data acquisition units that the students will learn how to talk to. again, all this is used in all kinds of facilities across the country, so that what they learn here they can apply everywhere. If you come on back here, you get to see where they hook up to the actual detectors. In this particular case here, we see a couple of PMT detectors where they actually figure out how to interface these systems together through the electronics. So they learn all about the electronics to talk to the detectors. So this particular setup here deals with playing with surface barrier detector, where we can change the density of the gas inside the can so that they can look at the properties of a response of the alpha particles. What we're going into is a research lab, but then we also try to incorporate an experiment that can be done from upstairs, the nuke lab that we just visited. So in here, we have designed a particular experiment so that the graduate students can then utilize the accelerator to collect data. Again, highlighting the fact that how to get the data is important, and then being able to make sure the data is quality. So signal processing is a big part of the educational program. And, so this particular lab here is called THEA, Toledo Heavy Ion Accelerator. And it's fairly low energy. It's a 300 kilovolt system. Be able to get more of a picture of where everything starts. This is the terminal here, and inside housed is the filament, where we can run solid, liquid, or gas and create a plasma out of that element. So in there we can put a solid in our oven to increase the vapor pressure, or use a gas. You can see the various gas lines coming over. And this whole system here is brought up to its known quality voltage, where we can then understand or determine that the energy of the particles that we're looking at exactly. So what happens inside here is, like I mentioned, we create a plasma. Then we have some potentials which pull out positive ions. So we have, this is called a positive ion accelerator. And so what happens inside there is we have electrons that come off a filament. It's thermometer emission that come back through the gas and strip electrons off the element of interest. And so now they are ionized, so we can control them. Before, when we start, most of them are not charged at all. So once we strip electrons off, we can then pull them out with an extraction voltage, which is usually set to 25,000 volts, and then pulled into a magnet. And that magnet allows us to filter out the species of interest. So we for the most part, are sure of the element when we get it down to the experimental station at the end of the lab. We may devise an experiment. The graduate students or undergraduates can pick a particular experiment or element to study, particularly with respect to spectroscopy. We could do lifetime measurements too. So we usually keep it simple. We may look at hydrogen or helium or argon, and the idea is we get a beam of that ion, usually singly or doubly charged ion, and filter it with a magnet so that we know specifically we have helium or argon or whatever coming down the pipe. And everything in here is under a vacuum, and that ribbed tube there is the acceleration column, where we give it that known energy. So it's 25,000 to pull get our ions out of the oven area, the source, and then we can give it an additional 300,000 and to accelerate them down to our experimental stations back here. And so we hide behind the Faraday cage while this is all going on. So our friend is the grounding rod. It's the first thing I pick up when I go in there. It's the last thing I take with me when I come out. And the system is interlocked so that if you go in, it turns everything off. As a matter of fact, health and safety are coming over Friday to do a survey to make sure everything is safe.
So we are here over in the radiology department today with Dr. Elza Malotti, and he is the chair of the radiology department, and he's going to take us on a tour of radiology and show us the facilities that are available to our students and residents.
Good morning, Dr. Pearson, and good morning to the committee. I'd like to welcome you to the radiology department. It's a pleasure to have you guys here. This is our academic offices. My office is here. Dr. Aldohan, our physicist office on this side. This is just the administrative office areas. But we'll take you to the areas which are more important from a standpoint of students needing to get exposure to exams, medical imaging, such as CT, MR, fluoroscopy units, X-ray units, and all those. So we'll take you to a tour real quick, a few minutes, show you equipments we have and what's available for our students to learn the diagnostic radiology aspects from a physics standpoint. So our physicist is the one who gives the diagnostic course for the students, for the graduate school, and also for our radiology residents, Dr. Aldohan, which hopefully you'll be meeting with him and over WebEx or video conferencing next week. But in the meantime, I'll show you the departments and the equipment we have and explain things as we go. So welcome again, and let's start our tour. All right, so this is our MR suite. This is the door to the MR units, which we'll enter right now. So I'll show you this 3T magnet. So coming in, we have a unit here which is the GE 3T MR scanner, which is the one that we use for most of our research as well as clinical practice. We have a second unit which is 1.5 Siemens Spree magnet, which is at the Ortho Center, mainly for musculoskeletal work. And but this one is the 3T magnet. The high resolution magnet is what we use for research. We do functional MR, which is the only unit in the region in Northwest Ohio that is able to do functional MR imaging for clinical practice and for research as well. So let me show you the unit while it's in action. Good morning. So if we can come from this side, you'll be able to see the imaging equipment itself. This is the console right here. So we have the MR control area where our technicians are using the studies and using the control room to do the scans. And here's the 3T high resolution magnet that we use for many applications, neuro application, neuroradiology, musculoskeletal, body imaging MRs, as well as breast MR and cardiac MR. So we use it for every clinical practice aspect as well as for functional MR research and other research aspects as well. And here is the CT scan suite area where we house 2 CT scan units. This is the first unit, which is a 64 multi-detector slice CT scanner from Toshiba, where we do most of our procedures as well as diagnostic workup as well. It has low dose capabilities, so a lot of the research these days and a lot of the clinical practice concentrates on reducing the radiation dose. And this is controlled and reviewed by our radiologists on different areas, the musculoskeletal, the body imaging, the neuroradiologists with our physicists trying to optimize our techniques using these scanners. And I'll show you now the second scanner, which is a 320. It's a 320 scanner, which is called Aquilion 1. It's called Aquilion 1 Toshiba scanner as well, which is state-of-the-art equipment, which basically allows us to do a brain perfusion scan of the entire brain in one revolution. So it allows us also to do high-end cardiac CTA examinations. And again, we run research on those two machines as well. Clinical research as well as basic science research. Let me show you that second unit, which is pretty similar to this one, but it's a gantry, which is different, has 320 slice scanner. So it has a bigger area of coverage, a better resolution, and less radiation exposure, and less use of contrast as well. And this is our Toshiba Aquilion 1 320 multi-detector slice scanner, which I kind of mentioned earlier. This is a high-end scanner that we probably have at the university campus, the only unit in the whole region which is able to do significant stroke work and entire brain perfusion in one revolution, which is fantastic for the stroke work that we do here. We're a stroke one center, so we are able to do the work needed for stroke patients immediately and in a very short amount of time, give the results so they can handle those patients and treat them accordingly within a few minutes of their arrival. And here is our fluoroscopy unit. This is where we do the fluoroscopy guided procedures, pain block procedures, lumbar punctures, myelograms, arthrograms, hip injections, shoulder injections, all kinds of procedures that we can do here, T-tube cholangiograms, nephrostograms, any GI studies can be done here as well. And again, this is a nice fluoroscopy unit because it can rotate in any angle. We can get frontal, lateral, oblique views and allows us to real-time visualize the areas of concern and the injection of dye into joint spaces. And we have another unit like that also for GI studies, and we have multiple X-ray units. And we have multiple C-arms for the OR use and also for GI, ERCPs, performance bronchoscopies, and such procedures. And thank you again for visiting with us today, and would love to have this physically, but unfortunately with the conditions, we have to try to show you what we have equipment-wise and explain things on a virtual and a video type pattern. But I'll be happy to answer any questions when we chat next week, hopefully.
So we're going to start our tour of the Health Science Campus on the Dana Cancer Center. So this is the beautiful Dana Cancer Center where our students and residents, our faculty, our physicians and therapists spend most of their time. This is our primary campus, and all of our academic spaces and offices, classrooms and dosimetry spaces, and most of our equipment is located here. So we're going to show you around this building, show you the places that we work, and show you the places that we teach. So let's go inside. Okay, so we are outside the physics and dosimetry room. We're going to include on our tour a tour of the facilities and the areas where students and residents and faculty all work together. So let's take a look inside the dosimetry area. So this is the physics and dosimetry area. What we have right here is the space where our students, residents and faculty all work together on all physics and dosimetry tasks. We have offices for junior residents, senior residents, our admin support, and then the rest of the offices around here are for the faculty. And then also at the back of the room, we also have a classroom space that we're going to show you. Okay, so here we have some of the posters that we have displayed at AAPM national meetings and at chapter meetings. We have posters all along this back wall from those previous meetings. And then also here we have a cabinet with bits of equipment that we like to use to demo to our students, such as flattening filters, cutaway magnetrons, photomultiplier tubes, thyrotrons and ion chambers, and some compensators that we have used in the past. So this is our little museum area. So one thing that we're particularly proud of is our board that we use to keep track of patients that are currently in the process of being planned. So they've had simulation and they are currently on the board because we're working on their treatment plans. So this is an example of the board with all the HIPAA information reviewed, but what you can see is names of patients, date at which they were simulated, areas that we're treating, and then this going from left to right is our the process that we have made in getting to the point where the patient can start treatment. Once all of these boxes are filled in, the patient is ready to start treatment. So we go over this every day. Students, residents, and faculty will meet every morning at 10 o'clock to go over all the patients that we have and talk about all the things that we need to do. So for the rest of the clinic area here, we have a variety of different computer systems. In the clinic, we use race station computers. We have the ability to do, we have 4 clinic computers for race station with the ability to remotely connect to more than that. We also have area systems, MIM systems for contouring and image fusion, and then along the back row we have additional computers for students and residents to work on so that they're able to do chat checks under the supervision of a physicist, and they're also able to work on pinnacle plans. So we have multiple treatment planning systems here. Race station is our main treatment planning system, but we are able to also show students how to do plans in Pinnacle. And then one of our satellite sites uses Eclipse, so we also have the ability to work on patients in Eclipse from here. So everything we need is in this space here.
Okay, the last thing I wanted to show you on our tour of the physics and dosimetry area is our classroom space. This is the space that we use for teaching many of the graduate classes that we have on our roster. It's also where we have meetings and chat rounds and things like that. Obviously, we have access to a large screen computer that we can use to go over chat rounds in front of everyone in the room. We can also use this for PowerPoint presentations, and I use this a lot for the classes that we teach in here. We also have a whiteboard that we can use to go over equations and things like that. So a lot of our classes have been taught online this last semester. We can actually record the presentations that we give here and send them to the students. The students can WebEx in and watch a presentation that I'm giving here in this room. So this is an ideal space for us, as it is reserved specifically for physics. We don't generally have to share this space with any other department, so that's good. So this is the beautiful lobby of the Dana Cancer Center. Upstairs we have medical oncology, and then downstairs, which is where we're going to head next, to take next up on our tour is going to be the radiation oncology clinic. Where we have just been is upstairs, the physics section, which is this area, and then down below that we have the CT scanner, HPR, and our therapy box. So let's go and take a look at the box. Okay, so this is the Clinical Operations Center. To this side we have our stereotactic machine, the Variant Edge, and to this side we have the vault for the TrueBeam machine. This would be where the therapists work. We're currently on lunch break, but now we're going to take a look inside the Edge vault to see what my colleagues are up to.
This is slightly bigger than our current.
So then, the only way to do that is to get a piece of the styrofoam.
Okay, so here we have the edge vault. This is our stereotactic machine, the variant edge. We have 6D couch, and we use this machine for a lot of our SBRT and SOS patients and things like prostates and stuff like that. Right now, we have students and faculty working on a project, a dosimetry project, and we're going to let these guys work. Okay, so we are in the Dana Cancer Center dedicated radiation therapy simulation suite. Right here we have our Philips big bore PET CT. So this is a PET CT system that we can use for radiation therapy patients. You can see that we have a radiation therapy compatible board that is used to simulate all of the therapy patients that come through this department, and is also used for diagnostic purposes, since this is the single PET CT system for this hospital. And this is our control area. And our students and residents are responsible for the QA of the imaging quality and the lap lasers for our imaging CT system. Okay, so we are in the academic space that is used for our graduate students. Over here we have a classroom space, so this is an additional classroom where we can teach classes. And this office space right here houses 4 to 5 PhD students, so that PhD students always have access to desk space and computers while they're over here on the health science campus. The computers that we have over here have access to software such as MATLAB, or they may have access on COMSOL, and they may have also have access to our dedicated medical physics cluster that is used for things like Monte Carlo simulations. This area here is actually only a short walk from the Dana Cancer Center. We're in the adjacent building, and we can access and go backwards and forwards between the two buildings, either above ground or through tunnels, since all of the buildings on this campus are interconnected with underground tunnels to avoid being outside in extreme weather conditions. So that's it for this space over here. We're now going to head back over to the Dana Cancer Center and take a look at the remaining spot on the tour, which is going to be our TrueBeam vault. So for the last part of the tour, we're going to take a look at the other LINAC vault that we have. This is our TrueBeam machine that we use for kind of general purpose radiation therapy. So let's go and take a look inside. So today we have Kingsley, one of our residents, and Kangaroo, one of our PhD students, setting up for a patient-specific QA using the ArcCheck. As I said, this machine is used as kind of general-purpose radiation therapy room. Has most of the same features as the other vaults, the Edge, and both of them get utilized by our learners. So. This is going to be the end of our tour of the radiation therapy department. We hope you enjoyed meeting with us, and this is going to have to be as good of an alternative to a tour as we can do. So thanks for watching.